Ladies and gentlemen, colleagues and friends, in fact, the conference also gives you an opportunity to meet old friends that I've not seen for quite a while, so it's been quite a welcome opportunity from that point of view. Now, the presentation that I'm going to be doing is on laboratory services, and I'm going to be focusing basically on the presentation would be on three parts. The first part is really just to talk a little bit around the importance of laboratory services as within the National Health Services context. The second part is to share a little bit around what NHLS has been doing, particularly around TB, HIV, and cervical screening, and then end up with some of the things that we would be doing over the coming months and years. But before I get into the presentation, in fact, this morning while I was having breakfast, I was looking at the Business Day. In fact, the headlines on the first page was Trust in Banks Slide to High Costs and Poor Service. I think some of you would have seen that. And I looked at that headline and I said, for many people in this audience, you can relate to that because you could easily change banks to NHLS. Because we're getting a lot of pressure now at the moment from our customers around the perception of high costs, and certainly in some areas around perception of quality of care. So what I wanted to do in this presentation is in fact talk to those very two issues, the issues around cost, the issues around quality of care, and locate laboratory services within the overall clinical management process. So let's look at laboratory services. In fact, one of the big issues, whenever I'm talking to provinces, and JJ asked me now whether I'm going to be putting up all the debt that's owed, I can assure him that I have no slide that talks about the debt that the provinces owe to us. But if you look at, when we're talking to individuals, whether it's particularly around managers, the big concern is around the affordability of laboratory services. And often we're seeing laboratory services as a cost rather than an investment. Because with laboratory services and with the right investments in laboratory services, we could see quite significant improvement in reduction in cost downstream. So with the right diagnosis, with the right clinical interventions, with our prevention and programs that we've put into place, I think that the investments that we make in laboratory services will ensure that we achieve savings lower down. And it should not really be seen as a cost, but really as a cost saver later on down the healthcare continuum. So the first point is really around how essential laboratory services are to appropriate and effective critical care. And when we're looking at HIV, it's absolutely critical to knowing our status. It's central to starting and continuing the ART programs and continuing to live positive lives. And getting to know HIV, AIDS, and TB prevalence and access to services requires effective and strong laboratory services. Identifying pregnant women living with HIV and AIDS, measuring the success of the PMTCT program, all of these require laboratory services. And lab services also provide important indicators for assessing quality of care. So why laboratory services? Diagnostic laboratory services, as I said earlier on, are central to health services provided to patients. It must be seen as part and parcel of the health services, and regrettably, because it's a back office function, often the importance of laboratory services are not seen within the overall continuum. 70 to 80% of all diagnoses and treatment decisions depend on effective laboratory services. Monitoring of response to treatment, saving lives, reducing overall healthcare costs that I talked about in the first few minutes, and supporting the practice of evidence-based medicine all depend on an effective and an efficient lab service. So just in terms of the way our lab services are developed, they're based on the discussions that are happening nationally and internationally. We looked at the Maputo Declaration, we looked at the Kampala Statement, and more recently the African Society of Laboratory Medicine. And all our strategies are developed based on the documents and the discussion that's been happening in South Africa and on the African continent over the last 5 years or so. Now to come to NHLS, so we know, hopefully we understand the importance now of laboratory services. To talk a little bit around NHLS itself, it's a unique model for the country. We came from a very fragmented laboratory service to now a consolidated, integrated, and a single provider for the entire country. And NHLS at the moment is set up as a state-owned enterprise and is a provider of choice for the public health system at the moment. Now, in terms of a footprint, there are currently 256 laboratories countrywide. And for last year, we conducted over 60 million tests. And the population that we serve or depend on the public health services, around between 80 and 85% of the population depend on us for lab services. We're focusing now on the priority programs, and the priority programs is really HIV, TB, and cervical screening, and is looking at how do we standardize and strengthen those programs. But obviously, everything that we do around these 3 priority programs have spin-off for the general strengthening of the systems for laboratory services in general, looking at data entry, reporting, quality assurance, analytical standardization, service mapping, and logistics. So we see that benefit coming out of whatever we develop around HIV and TB. And activities are in line with global recognition that laboratory services need strengthening. Now, despite the fact that there may be perceptions around cost, and I accept that certainly there's a lot more that can be done from a cost perspective. But just to touch on a couple of points that I think is worth mentioning. The one is that NHLS, I think, is a national asset, and I think that it needs to be protected and strengthened and, in fact, deepened. And that the first point that I wanted to make was around, despite the perception of high costs, we actually are quite a low-cost service. In fact, the percentages that are spent on laboratory services in the country hovers around 3% of the total health spend. And certainly in comparison with many other countries, that's quite low. And I think my own sense is that probably more money needs to be spent in terms of the total health spend. And I'm hoping that as we go along, we'll be able to convince frontline clinicians, but particularly convince managers about the centrality of the role of laboratory services. So we are the lowest cost provider in the country at the moment. I think from a quality point of view, we'd compare with anything that one would see in South Africa, whether it's public or private, or for that matter, anything that one would see anywhere else in the world. We're sitting with some of the best, the world-class skills within the laboratory services. And in terms of technology, we're at the leading edge at the moment. And in fact, Melinda, you talked about the GeneXpert, and I'll say a little bit more about the GeneXpert in a few minutes' time. And from a footprint point of view, we have a national footprint with a strong rural reach, and we have a network of reference labs as well. So just to give a sense of the scale of the program that is currently run in the country. So if we're looking at HIV, in the HIV context and testing, there are over 1 million individuals on ARV treatment at the moment. And from a lab perspective, we have 69 CD4 laboratories nationally. And in 2010, 3.5 million CD4 tests were done. We have 16 HIV viral load testing sites. 1.2 million HIV viral loads were done in 2010. 11 HIV DNA PCR testing for early infant diagnosis, with 270,000 HIV DNA PCR in 2010 done. And we have 5 HIV drug resistance testing centers, and there are plans for an expansion program in place with 1,200 routine HIV genotypes requested last year. So again, if you look at this table here and you're looking at the volumes of tests, and we look at the way it's increased over years, from 1.2 million tests to currently around 3.4 million tests. And that's been quite significant in volume increase, and that's meant that we've had to increase our capacity and our footprint to respond to the demand out there. And again, another table here looking at TB directs and TB cultures. And again, it's really to make the point, don't worry too much about the figures, but it's really to make the point about how we've increased over time. And if you're looking at 2011, for the first quarter, it's already over 1 million tests. And clearly the HCT program that's been led by the National Minister of Health, you can see the impact of it already in the tests that have taken place already. So for the national priority programs, if you're looking at the 5-year figures there, and it kind of gives you a sense of how CD4 has increased, how viral loads have increased, and how PCR has increased over time. But just again, what is unique about that? The team that's working on it, we've looked at standardization of equipment, so all our equipment is standardized. We have standard operating procedures, training for improvement of quality is in place, and programs to look at affordability. In fact, over the last 2 years, we've been able to successfully reduce prices by negotiating, renegotiating our costs for the reagents, etc., and putting in new tenders in place. And in 2010, we were able to reduce prices by 10%, and for 2011, we reduced by a further 5% for the priority programs. The platforms themselves are highly automated at the moment, and we've developed in-house external quality assurance programs and validations, and they are real-time monitoring for errors. And all our instruments are interfaced, and we have quite a significant database at this point in time. On TB, 70%, all of us are aware that 70% of TB suspects are co-infected with HIV. TB and HIV co-infection, an increasing proportion of cases that are sputum smear negative and or extrapulmonary. Over 4.7 million TB microscopy smears was conducted in 2010 in 244 microscopy sites across the country. 1 million TB cultures were done, 22% of which were positive nationally. The big issue now at the moment is how do we increase turnaround times? And at this point in time, under the leadership of the National Minister of Health and the National Department, we've looked at the GeneXpert, which is technology now that will give results within 2 hours. For World TB Day, through the support of USAID and other partners, we were able to put in the first GeneXpert at Prince Mshiani in Durban. This map here just gives you a sense of where are our microscopy sites. If you're looking at all of those dots is where the microscopy sites are at the moment. And the next one looks at in the first phase of the implementation of the GeneXpert, and is really responding to be able to get results sooner so that treatment can be initiated a lot faster. These are the sites that we currently have. And in partnership with the Department of Health, there's a plan to develop a national rollout program so that GeneXperts can be available throughout the country over the next 18 to 36 months. Well, this really talks to what we have at the moment. There are 25 sites in 9 provinces across at this point in time, with 30 instruments that are available, with a mix of from the Infinity to the GX4 and the GX16. And these are just pictures of the implementation of this is at Prince Mshiani. And here you can see the main man, the Minister of Health, opening the GeneXpert at Prince Mshiani. And I think that this is going to make a profound difference to the way we respond to TB in the country. And then for clinicians and for managers, there's a range of tools that have been developed to help us ensure that we have better monitoring, that we can do better planning, and that in fact we can make important decisions about how we allocate resources for the priority programs. And these tools are available. You can look, there's a dashboard that has been created. It can be used at clinic, at lab, at district, and at provincial level. It gives important information to managers and frontline clinicians on what's happening on the ground. And hopefully it'll help you strengthen the programs that you have. And this report is on the early infant diagnosis. From that report, you got a good sense of what is the total PCR tests that were done for all ages, what is the PCR for less than 5, and it gives you a sense of the measured against the estimated number of HIV diagnosed infants. So you got a sense of, are you achieving the targets? Are you doing badly? And where would you be doing badly? You can drill down to find out where, and then do the appropriate interventions. And this is another report that looks at GIS mapping that brings in activity data and locates it around, and shows you around the facilities that we have around the country. So for managers, you can get a good feel by just looking at these maps, how well you're doing. And if there was a need for an intervention, you know exactly where to intervene. And all these reports are now routinely available. So just on point of care testing. Now the issue for us, there's this huge tension between costs and affordability and the need for us to be present closest to where the patient is. And clearly, we need to look at those kinds of services that we can centralize, that we can standardize and we can automate. And if we do that, we can bring down costs quite significantly. But at the same time, we have to balance that tension being closest to where the patient is. And so to do that, there's a range of new point of care technology that's now available. And there are teams, expert teams that are in place that's looking at how do we get the balance between centralization and decentralization. And our sense is that the use of point of care and the GeneXpert is potentially one of those instruments that can be used as point of care technology. And there are teams that are looking at assay validation, that's looking at quality control, that's looking at patient and clinician acceptance, that's looking at how would we interface these tiny instruments to our lab information system so that we can track and monitor and do surveillance, and looking at developing standardized operating procedures, looking at our biosafety requirements, and then developing policies. And then key to all of that, because obviously we survive on the revenue that we generate, is then what is the reimbursement mechanisms that we need to put into place. So there's extensive work being done there so that we don't just move everything to centralization and forget about the fact that we need to get results, because we're really in the business of providing test results so that clinicians can make the kind of decisions that they have to from a treatment perspective. So on the national priority programs at this point at this conference, in fact, there are 4 areas. There are several presentations that are being done by staff from NHLS. It just gives you a sense of what are those presentations. Some of you may have attended that. You can kind of see the spread from HIV to CD4 testing to POCT and HIV resistance testing. So just to wrap up on the last 2 slides, going forward, I think that the model that's been developed around NHLS has been appropriate for its first 10 years of existence. We clearly need to look seriously around the model, whether or not it's going to be appropriate to deliver for the next 10 years. And our sense is that we need to do some fairly major changes to the model. We need to relook at the financing model. We need to look at the service model. And from that perspective, we've identified kind of 10 strategic drivers. And it's really to give you a sense of where we're going to, but also for you to be able to engage with this process. So one is about developing a new service delivery model that's more affordable for the public health sector. The second point is really around determining a best fit service delivery model. And again, it's around this tension between centralization. How much do you centralize? And what do you keep closest to where patients are? Then around delivering quality and a customer-focused service. And I think there's been a period where the gap between our customers and ourselves seemed to have widened. I hope over the last 12 to 18 months, we've seen a coming together of the laboratory services and the rest of the health services. And I think that we're doing reasonably well in that area. And the fourth point is really around aligning resources, support services, and infrastructure development for this new service model that we are in the process of developing. And then the big issue is, and in fact yesterday there was a session around human resources development. We suffer with the same kind of issues that the rest of the health system suffers in attracting and retaining talented and experienced and qualified individuals to deliver the high quality services that we have in place. So it's really about how do we become an employer of choice and how do we attract people into the National Health Laboratory Services for them to develop their future with us. And then the 6th point really talked about how do we do things differently. Because clearly, the scale of the problem is so significant that we have to find different ways. And now, the focus is really around innovation and around research that is relevant and appropriate to do the leading edge things that we have to do over the next decade. The seventh point is really around becoming a health information powerhouse. We're sitting with some of the most powerful databases, and I don't think that we use that effectively enough. So it's really to strengthen that area from a surveillance point of view, but also from a planning, monitoring, and a resource allocation point of view, to work with the provincial departments of health, to work with the National Department of Health, so that information becomes more meaningful. And then the eighth point is around stakeholder collaboration. And again, because of the scale that we have to deal with, my sense is that we can't do this alone. We have to strengthen our partnerships with donors. We have to strengthen our partnership with NGOs. We have to strengthen our partnership with private sector providers so that we can collectively respond to the new challenges that we're faced with. And then the ninth point is really about how do we position ourselves for national health insurance. Now, national health insurance really requires a very different service model, but more importantly, it requires a very different reimbursement mechanism. Clearly, the fee-for-service model is not going to be able, we're not going to be able to sustain going forward. So we have to start looking at what are going to be the reimbursement mechanisms for NHLS, and in fact for pathology in general, but really also to inform the national health insurance process so that when they develop something, whatever is developed is actually sustainable for the health services, but sustainable for the country as well. And then the last point is really about how do we protect the community and the environment. So for us, the issue is that how do we become better? How do we become cheaper? How do we become faster? And there are a couple of things that we're working on at the moment, and we can't do this alone. We have to do that in consultation with you. The one area is that we don't have a laboratory policy for the country at this point. So I think that there's an urgent need to develop a laboratory policy, because out of the laboratory policy, we can then start looking at what is the strategy for laboratory services going forward. So there's some work that's being done on the lab policy. There's some work extensive work that's being done on developing a kind of master plan for laboratory services for the country, looking at what are going to be the health technology requirements going forward. What is the infrastructure requirements going forward? Are labs going to get bigger or are they going to get smaller? What are the human resources requirement? Because we have three mandates. The one mandate is service, but the other two mandates are equally important. We train all pathologists for the country, and we undertake research as well. So we need to look at what are the human resources requirements, not just for NHLS, but for the country as a whole. And then to look at developing a new funding model for laboratory services provision for the country. Then reviewing the current funding model for teaching and research, because at the moment we've got to generate sufficient revenue to pay for our operations, pay for teaching and research, and there's been some extensive discussions with the National Department of Health to look at the possibility of providing other funds so that we can reduce costs of tests to the provinces that we're supporting at the moment. And central to all of this is that we've got to have a customer, but really a patient-centric strategy going forward. And then this model that I talked about around standardization, centralization, and automation, because I think that's what will give us the reduced costs going forward. So in conclusion then, Chair, I think that we all have to start, we got to act now. And you can sense the energy in the conference over the last couple of days. And I think we're all committed to the same thing. We've got to act now. Clearly, we have to work together because, as I said, the scale of the problem is too big for just the Department of Health on its own or National Health Laboratory Services on its own. We've got to look at the partnerships. We've got to strengthen those partnerships in going forward. And the one thing that I've learned in the 2 years that I've been in NHLS, the conventional ways seems to be failing us at every point that we look at. So we've got to start looking at doing things differently. Thank you, Chair.